Good morning. I am Dr. Sanjay Venugopal, Professor and Head, Department of Periodontics, Sri Siddhartha Dental College. Today I will be speaking on a topic called resective osseous surgery. Now, osseous surgery is that aspect of the periodontal surgery which deals with the modification of the bony structures around the teeth. Now, surgical removal of the alveolar crest bone was followed long time back when modified Whitman flap were designed also. But the rationale of removing the bone at that period of time was that the bone was considered to be infective and infective. So they advocated removal of this bone so that it facilitates better wound healing. But this aspect was then discontinued as Kronfeld in the year 1935 showed that the bone is neither infected, so it need not be removed during the surgical time. Now, periodontal disease results in the loss of bone around the tooth structure. This may not be even, it may be uneven in most of the places. Now, Goldman in 1950 suggested that the form and shape of the alveolar bone depends on the underlying bony structure. So, they advocate that surgical correction of the bone will, during the periodontal surgical treatment, will lead to the recurrence of the pocket will be very much minimalized as the the periodontal soft tissue will be properly adapted. Now, again, this also was the surgical correction of the removing of the bone during the periodontal surgery was advocated by Ossenbein and Friedman and Pritchard, but this also was discontinued as they showed that even with the reflection of the mucoperiosteal flap, it resulted in the resorption of the crestal bone. So, further correction or removal of bone was not necessary. So, osseous surgery is of basically two types: additive or regenerative osseous surgery and subtractive or resective osseous surgery. Additive is where we add bone to the osseous defect to correct it, whereas resective is the one where we remove the bone to create a more favorable bony architecture which does not promote plaque accumulation. Today I will be discussing with you about resective osseous surgery. Now, resective osseous surgery is basically of two types. One is called as osteectomy and one is called as osteoplasty. Osteoplasty is basically like gingivoplasty, where the bone is removed so that it achieves the more physiological contour of this. In this procedure, we do not remove any supporting alveolar bone, whereas osteectomy is a procedure where the supporting alveolar bone is removed to achieve the goal. So, basically osteectomy is procedure where we remove the supporting alveolar bone, whereas osteoplasty is a procedure where we correct the osseous deformity without removing any supporting alveolar bone. So, the instruments what we can use for doing this osseous surgical procedures are: one is rotary instrument, and one is hand instrument. The rotary instrument usually consists of the burrs, whereas hand instrument they consist of files, chisels, etc. The care should be taken when you are doing the rotary instrument like burrs, that when we use it for correction, that we do not lead to excess heat generation. So, it should be used very carefully without generating excess heat, otherwise it may lead to necrosis of the bone. Now, before we go ahead with the topic, we will just discuss about what are the types of the bony architecture which is seen around the tooth. There are three types of bony architecture which is seen around the teeth. One is positive architecture, one is flat architecture, and one is negative architecture. Now, what are these three types of architecture? The positive architecture means that the interradicular bone is coronal to the facial and lingual bone. So, that creates a scallop bony margin, whereas flat architecture is where the interradicular bone and the facial and lingual bone are at the same level, leading to a flat architecture, whereas negative architecture is one where the interradicular bone is apical to the facial and lingual bone, resulting in the negative architecture. The negative architecture or reverse architecture is the one which results in the periodontal disease and needs to be corrected. So, There is another term which we use in resective osseous surgery, that is a definitive osseous resective surgery and compromised osseous resective surgery. The definitive osseous resective surgery means that when we do this procedure, further we cannot achieve any further improvement in the final goal. That means if we remove any further bone, it may not result in any other improvement in the treatment plan. Whereas compromised resective osseous surgery means that further correction may be possible, but it cannot be done without removal of bone, which may have adverse effect on the overall treatment plan. So that means when we compromise resective osseous surgery procedure, improvement can be gained, but it may result in the adverse effect in the final treatment plan. That means that if you remove the bone, the teeth may become compromised because of removing the bone. So it may not be advocated to go ahead with the procedure. The next is what are the various steps in doing this resective osseous surgery. Now there are 4 steps in resective osseous surgery, where the step 1 is called as vertical grooving, step 2 is radicular blending, step 3 is flattening the interproximal bone, and step 4 is gradualizing of marginal bone. So what is step 1? Step 1, vertical grooving, is usually done with the help of rotary instruments or rotary burrs, in which the alveolar process of the jaw is thin by making vertical grooves in the extending into the apical aspect. Now care should be taken, as I mentioned earlier, that whenever you are using rotary instrument, you should take the necessary precaution of cooling or using coolant, so that the heat is not generated excessively. The second step is radicular blending, where these vertical grooves are blended with the interproximal bone, and thereby thereby we are creating a smooth facial bone. And the third is flattening of interproximal bone. In the flattening of the interproximal bone, we correct the defects like hemisepta or one wall defect, in which the interproximal bone is flattened. So again, when you are doing this procedure, we have to see to that we do not do any damage, because this step may result in removing some amount of supporting alveolar bone structure also. The last one is gradualization of the marginal bone, where the bone around the cervical areas of the tooth is smoothened so that it blends properly. Now again, in this we have to see to that when you are using rotary instrument to smoothen the marginal bone around the sulcus, that we do not cause any niches on the tooth surface. That may result as a result of using the rotary instrument improperly. And again, when you are removing the bone in the interproximal region, there are chances of causing small widow's peak. This widow's peak can again result in damaging the underlying periodontium. So this precaution should be taken, so that when we are doing this procedure, we do not cause any damage to the surrounding area. So these are all the 4 steps which we follow for doing the resective osseous. First is the vertical grooving, then radicular blending, and flattening the interproximal bone, and lastly the graduation of the marginal bone. So in this chapter, what we do is, why we do the resective osseous surgery? We do the resective osseous surgery so that we gain a proper physiological underlying bony contour, so that the overlying gingiva also assumes the same shape and does not lead to or corrects the formation or progression of periodontal disease. Next is we should know what are the types of resective osseous surgery. There are 2 types of resective osseous surgery. One is osteoplasty and osteectomy. What is the difference between the two? You should be aware of. Osteoplasty is a procedure in which the bone is correction is done without removing the supporting alveolar bone, and in osteoplasty, correction is done with removing the supporting alveolar bone. Next, you should know the types of the architecture which is present in the around the teeth, that is the positive architecture, flat architecture, and the negative or reverse architecture. Then you should know what are the types of resective osseous surgery, that is the definitive osseous surgery and compromised osseous surgery. What is the difference between the two? Definitive is that if you do go ahead further with the correction, it may not lead to any improvement, whereas compromise, in which we can achieve further improvement, but while doing the correction, it may result the damage to the tooth stability or foundation. So, and the lastly, we should know about the what are the steps which we will follow for doing this procedure, and what are the instruments what we use to following this procedure, that the rotary instruments and the hand instruments. And with this, I would like to end my topic today. Thank you.